Hi everyone, this is Dr. Stefan. Welcome to Interstitial Lung Disease Info. In this episode, I'd like to discuss about a very simple distinction that I've come across in one of the comments. Pulmonary fibrosis versus residual fibrosis. And this is, just a bit of a terminology issue that I think a lot of patients are confused by. So when you look up information about pulmonary fibrosis online, most people think that this is to do with idiopathic pulmonary fibrosis, which is a condition in itself. It's a specific diagnosis that just means lung scarring of an unknown cause. But to arrive at this diagnosis, we need to rule out a bunch of other conditions. And we know that idiopathic pulmonary fibrosis, or IPF, is a progressive condition. It can be associated with a poor prognosis, and many people are afraid of that diagnosis. But then when we say pulmonary fibrosis, everyone tends to think that this is IPF, idiopathic pulmonary fibrosis. This is not true. So idiopathic pulmonary fibrosis is one diagnosis. Pulmonary fibrosis just means lung scarring. When we say lung scarring, then we need to figure out if that is idiopathic pulmonary fibrosis or another type of pulmonary fibrosis that has a known cause. And I've spoken about this in other videos. Please look them up in my channel if you are interested. There are a lot of other causes for pulmonary fibrosis that your doctor may look into. And it's really important to clarify what your diagnosis is with your doctor. Just saying pulmonary fibrosis is generally not enough. That just means lung scarring. That's what the words actually mean. Now, residual fibrosis, this was the comment that made me make this video. The question in the comment was basically whether residual fibrosis is actually pulmonary fibrosis. And I think the person who made that comment was worried about was that what they have as a result on their CT scan or something like that was potentially idiopathic pulmonary fibrosis. Now, residual fibrosis just means scarring that's left residual after something has happened. Now, this is most commonly due to having a very bad chest infection. Sometimes people who have had, for example, tuberculosis in the past, so TB, pulmonary tuberculosis, they may be left with scars following that chest infection, following that lung infection. That may have gone away. Those scars tend to not get worse over time. And that's what the terminology refers to generally when we talk about residual fibrosis or residual scarring or scars on the lung that have been left residual after something else. So I hope this clarifies things a little bit because I think it's a little bit of an issue when people get to see their chest CT reports, for example, their radiology reports. There is a mention of fibrosis and people think about idiopathic pulmonary fibrosis, which is just one diagnosis among the many types of pulmonary fibrosis or lung scarring. So again, just to clarify, pulmonary refers to lung, fibrosis refers indeed to scarring, residual refers to something that's been left from something else that has happened in the past, generally a bad chest infection. Now, usually, I mentioned the infections. Let me go a little bit deeper because maybe this helps a little bit to better understand this. So you can have residual scarring, residual fibrosis, following, like I said, tuberculosis. It could have been potentially someone who have spent some time in an intensive care unit following a very bad lung injury. That could have been something to do with an exposure, something to do with a bad infection, someone who developed acute respiratory distress syndrome or ARDS. That can sometimes lead to scars on the lung. Someone who has been ventilated for a long time in the intensive care unit may have developed some scars due to whatever was going on in the lungs at that time. Now, it can differ from person to person. In most situations, when we talk about residual scarring, residual fibrosis, we're not talking about a progressive form of pulmonary fibrosis. But again, situations can be nuanced. It's not always the case that we can just draw the conclusion just as easily as just saying, yes, it's residual, nothing will happen in the future. But I know that on many patient letters, you will see this term, pulmonary fibrosis, having fibrosis on the lungs, scars on the lungs. And a lot of patients do get really, really worried, especially because when you look things up online, you tend to come up with the worst possible diagnosis because there isn't a lot of information out there. And that's one of the main reasons why I started this channel, because the information that my patients were seeing when they were looking things online was really scary. And actually, I'm trying to just dilute that information with some other bits of information, just to let you know that pulmonary fibrosis means lung scarring. It's generally important to figure out if there is a known cause, to treat that cause, to remove that cause, whether it's something occupational, whether it's something related to another condition that that person is experiencing. And then if we cannot really find the cause for it, then we may call it idiopathic. Based on the pattern, based on the behavior of the disease, do these scars actually get worse over time? We monitor the patient, we see what's going on in the future. And then there are medications that can potentially slow down the scarring, even when it is progressive. So there are options out there. Please discuss with your healthcare provider, in your case, what your diagnosis is. This is the most important thing. I wouldn't want you to just go online and become really, really scared, really afraid. Put your affairs in order, things of that nature. Try to figure out exactly what's going on. Try to understand your situation, understand with your doctor, together with your healthcare team, because it's such a nuanced field, to figure out what's the best treatment for you in your case. Do you need any treatment, or do you just need a bit of monitoring over time to figure out what's going on with those scars on the lung with that pulmonary fibrosis? Hopefully this was helpful and a bit reassuring, but I do think it's a very difficult topic. I know a lot of you who are watching these videos are afraid about your own health, or maybe someone you care about, a friend, family member. Please encourage these people to go and seek help with their healthcare providers, to understand their situation, to see whether the fibrosis is the main problem, if it can be treated, if anything can be done in that situation, what's the optimal solution. Hopefully it was helpful. If you have further questions, do leave them in the comment section below, and I'll see you in future videos. All the best.